as you rightly say, the perception is that, whether consciously or unconsciously, that women are responsible for the majority of infertility cases. But actually the opposite is true. Globally, 35 to 45% of infertility cases are male only. About 30% are female only, and the rest are a combination of the two. And actually, if you look at the fertility of the human population as a whole, it's the rapidly declining fertility of men that is going to be the biggest issue. So the global sperm count has halved in the past 30 years. It's dropped by 50%, and it's trending to zero by 2040, which means that by 2040, the majority of couples will struggle to conceive naturally, because the sperm count on average across the male population will be zero. And the reason for this is...
All right, welcome back. This is Tell Me Why. I'm Maria Botros, and we always enjoy discussing health and well-being, women's health specifically. And today's guest is Sophie Smith, who is the founder and CEO of NAPTA Health. And today she's going to be talking to us about anything and everything related to a woman's health, from the insurance policies that companies have to offer to menopause, puberty. We're going to try to discuss as much as we can today. And obviously, if there's something that we don't necessarily have time for, we will always bring her back if she has the time for us.
She has the time for you.
Okay, that's great. Sophie, how are you?
I'm very well. Thank you for having me, Maria.
Yeah, no, it's an absolute pleasure. Before we get started, I want you to tell us, me and the audience, about yourself. So are you a doctor, or did your concept of NAPTA Health just come out of the fact that you are a woman and you noticed some gaps and you wanted to fill those gaps?
That is precisely where the concept of NAPTA came from. Maybe to give a little bit more context. So I have parents who are doctors.
Okay.
My father, until recently, was the National Clinical Director of Diagnostics for the NHS. So very senior in diagnostics. And without a doubt, that's where my interest in diagnosis comes from.
Okay.
But I have a business and technology background. And before I founded NAPTA, I'd actually gone through the process after leaving Accenture in 2014 of setting up a number of businesses, all in the impact space in quite quick succession. So NAPTA was actually my 5th company in 4 years. And that was not about setting up a lot of companies. It was about trying to find the thing that I really cared about and the business that was right for me. So we moved here in September 2016. I was newly married. I was pregnant. I had just set up a company in Sierra Leone that does waste plastics to roads. And I moved here and I thought, I need to do something locally. Sierra Leone is 24 hours one way from the UAE.
Yeah.
It's not a particularly pregnancy or new baby friendly place. And I thought, I want to do something that is really relevant and impactful here. And I went to speak at a conference in Kuwait on diabetes and got chatting to the organizer not about diabetes, but about the fact that I was pregnant, which he found unusually fascinating.
Okay.
And about a month later, he sent me a whole load of stats on women's health in the region and said, do you want to do something in women's health together? And I still remember very vividly receiving this presentation and these statistics. I was sitting in the Impact Hub in Suka Baha, and the stats were obviously poor.
Okay.
80% of breast cancers diagnosed at stage 4, which has a 27% 5-year survival rate versus diagnosis at stages 1 and 2. It's the opposite way around in the UK. 80% are diagnosed at stages 1 and 2. 40% of women in the MENA region were not attending a single antenatal appointment, which meant that, if you were at risk for things like gestational diabetes, preterm births, preeclampsia, that wasn't being picked up. A lot of women were miscarrying where they didn't have to, where there was no reason for them to miscarry. A lot of taboos, a lot of stigma. I mean, we're talking 2016, pre-COVID.
Yeah.
Pre a lot of the movement that we've seen in the region over the past few years.
Right.
And as soon as I saw this deck, I thought, yes, this is the company that I want to run, and that I hope I will be running actually for the next 30 years.
Okay.
I asked for a bit of time to have my baby,
okay,
hand over my existing business interests. In the end, we started NAPTA the day my son was due, so 21st of March 2017.
Amazing. That's a nice start anyway. But I just want to go back to the fact that you were saying, the statistics were shocking and you found that the research was kind of, I don't want to say weak, but there wasn't enough, let's say, at the time. Why do you think that was? Why do you think that was the case?
So it's one of these things that the more you dug into it, kind of the more shocking the statistics were and the more gaping the hole. Women were largely excluded from clinical trials globally until 1993.
Okay.
And you could argue that this was done out of a sense of sort of fiduciary and responsibility towards women. They didn't want to impact female fertility by including them in trials for things that could affect that. But the result was that most of what we have in medicine still today was designed for and tested on predominantly white men.
Male figures.
And still today, only 19% of clinical trial participants are female. So there's a big gap in terms of gender equity in healthcare. Women are it takes 4 times longer to diagnose women with the same chronic diseases as men, despite the fact that they're twice as likely to see a doctor in the first place. There are a lot of other stats that highlight the gender disparities. And then if you build on top of that the fact that 92% of trials are held in the US and Europe, and the remaining 8% are mostly held in the Far East, where they have to be demographically representative. Only a tiny percentage of the 19% of clinical trial participants that are female are of Middle Eastern, African, and South Asian origin.
Wow.
And you see the result of this even more in the health outcomes. So if you are a woman of African origin in the United States, you are 4 times as likely to die during pregnancy and childbirth than a white Caucasian woman. If you were a woman of Pakistani origin, you were 3 times more likely to die with COVID than a white Caucasian woman. And the only way that you address these systemic gender and racial biases is not by building in the US or building in the UK or building in Europe or building in the Far East, where you would have to be demographically representative. It's by building things by and for women here, where the minority populations of the US are the majority.
Of course, yeah. So you mentioned this, and this was actually my next question, the systemic gender and racial biases. I know that part of what you're doing with NAPTA is you're trying to tackle these biases and you're trying to sort of counter these biases. So can you tell us a bit more, like what are some other biases that we spoke about this before the show? Actually, we were speaking about infertility, and because we just had a guest recently who came in and talked about infertility, and he was saying one of the main misconceptions is that people think when they hear infertility, they automatically think women. They automatically think that it's in the woman rather than also shared by the man. So can you tell us some more biases and tell us about the statistics when it comes to infertility?
So infertility is a really good example, actually. As you rightly say, the perception is that, whether consciously or unconsciously, that women are responsible for the majority of infertility cases. But actually the opposite is true. Globally, 35 to 45% of infertility cases are male only. About 30% are female only, and the rest are a combination of the two. And actually, if you look at the fertility of the human population as a whole, it's the rapidly declining fertility of men that is going to be the biggest issue. So the global sperm count has halved in the past 30 years. It's dropped by 50%, and it's trending to 0 by 2040, which means that by 2040, the majority of couples will struggle to conceive naturally because the sperm count on average across the male population will be 0. And the reason for this is environmental factors, sedentary lifestyle, and then the growing prevalence of chronic diseases. Chronic diseases that could be everything from diabetes to its much earlier precursor, insulin resistance.
Of course, insulin resistance. It's funny that you mention that because a lot of people now are realizing that they are insulin resistant because of their lifestyle, their diet, or whatnot. Okay, what are other biases that you are trying to tackle? I mean, apart from infertility, what are other gender or racial biases that you're trying to tackle?
Gosh, there are so many.
I mean, mention maybe like the top 3 or just any 3. Yeah.
I think biases that really prevent women from accessing the same opportunities perhaps as their male counterparts are those around postpartum recovery and perimenopause.
Right.
So in the UAE at the moment, if you apply for an individual insurance premium, perimenopause, or if you put down menopause, is categorized as a pre-existing condition.
Oh.
And so your insurance premium would automatically go up. If you said you were perimenopausal, the minimum you would be quoted would be about 35,000 dirham.
Wow.
Per annum.
Wow.
At the moment, there is not, so insurance will not cover hormone replacement therapy, or in fact any of the therapies that are commonly recommended for women going through perimenopause. So all of the things that you might need to support you with the 35 plus symptoms that you experience going through menopause are currently not supported at all by the existing healthcare ecosystem from a financial perspective. So that's an example of a bias. And again, if we think about the ramifications of this for women in the workforce, you know, a lot of companies now have set very strongly worded DE&I mandates for themselves. They're going to try and attract and retain more female talent. They're going to try and get more women to senior leadership positions. They want more women on the board.
Yeah.
What do you think most of those women are going through when they're trying to push for those senior leadership and board level positions? Perimenopause. So if you don't have adequate support for women at that point in their lives, and today the healthcare ecosystem, you can have the best healthcare insurance, but ultimately that health insurance is a gateway to the established healthcare ecosystem. If that system is not set up to support women through perimenopause, then they will not be supported.
Yeah.
A good bias is potentially around postpartum rehabilitation. So there's this assumption that kind of women need to bounce back after giving birth.
Oh, yeah.
And there's now a countercultural movement that says women don't need to bounce back. And that's because when we think about bouncing back, what we're predominantly thinking about is how women look. But actually, bouncing back physically, mentally, for women to get to that place where they really feel like themselves again is really important.
Right.
Because you need to be strong physically, mentally, nutritionally to deal with this life that you have created. You need to be physically strong so that you and rehabilitated so that you don't end up with things like incontinence and prolapse, particularly as you enter perimenopause, where hormonal changes may exacerbate these things. So there is a need for women to rehabilitate themselves postpartum, but not in the way that maybe the media portrays.
Yes.
And for women to understand how that happens and to access care for it is still today is very difficult.
Yeah.
You cannot submit a claim with most insurance providers for pelvic floor rehabilitation and have it covered by insurance. Insurance will cover a claim for back pain, but they won't. And so for the physiotherapy to rehabilitate back pain, but if you have a weakened pelvic floor causing incontinence, or you have abdominal muscle separation, that wouldn't be covered by insurance. So most doctors today, if they want to help women physically rehabilitate, will submit a claim for back pain.
Of course.
But that's another bias that exists. So this idea that either bouncing back is essential or counterculturally bouncing back is bad. But the idea that we need to support women in getting back to a good place from a physical and a mental perspective is kind of not discussed in the right way and not enabled by the system.
Right. Okay. So this is actually a good segue into the next question, and it relates back to a point that you were just speaking about. Why? So tell me why. Why do you think companies need to rethink these health services that they're offering their women, or not health services, but the insurance policies that they're offering women in the company? And I feel like, are they matching it? You were saying, you know, a lot of these companies are saying, oh, we want more women in leadership positions. We want more women to grow. They want to meet that, they want to check that box. But are you living up to that promise, or that I don't know what to call it, but are you living up to that expectation that women have when they come into your company?
That is a lot of questions.
Sorry, I was
interrelated.
It's a loaded question.
It is a
but
loaded question. A question loaded with many other questions. So, are companies living up to expectations? What is stopping companies from providing women with the care they need? Okay, I'll take a step back. Actually, I think one of the biggest problems is that no company wants to admit that it is not doing the right thing by its employees.
Of course.
And no company wants to admit that it is offering fundamentally different services and care to its men versus its women. And that's one of the challenges, is explaining to companies, we know you want to do the best by your employees. This bias that we're talking about, it's not with you. It's with the established healthcare ecosystem. And that has a long legacy that actually has nothing to do with the healthcare providers here and everything to do with how clinical trials were conducted, the process of including people in clinical trials, like the way that was set up.
Right.
So you need to make it, you're not there to accuse anybody. What you're there to do is to say, we know you have this mandate that you want to hit, and it's a good thing because diversity in companies increases profitability. That's been proven.
Right.
And these are the ways that, these are the things you're going to have to acknowledge, and this is a way we can address them. Why is traditional healthcare not meeting the needs of women? We've already covered some of that, some of the systemic gender and racial biases in healthcare. But why fundamentally is it not addressing the needs of women? It's because traditional healthcare was not designed to treat chronic diseases. And today, chronic diseases are the majority of the disease burden, and it's increasing.
Of course.
When hospitals, the likes of which we see today, were built in the early 1900s, 85% of the things that they were there to treat were acute diseases, pneumonia, broken limbs,
right.
A lot of respiratory diseases, a lot of infectious diseases that don't exist anymore.
Yeah, they're like, they need a one-time treatment and that's it.
Exactly. So you diagnose the disease, you treat the disease, it goes away, and so does the person.
And that's it, yeah.
Unfortunately today, acute diseases fortunately only account for 30%. 70% of the disease burden is chronic. It doesn't matter how much you intervene or prescribe for a chronic disease, because at the heart of a chronic disease is lifestyle factors.
Of course.
That disease doesn't go away. So the person keeps coming back. They take more drugs. They have more interventions. They become dependent on very expensive things that were designed to be used as a one-off and then not again, hopefully for years. And so you've got a traditional healthcare system that is not really built to support the majority of the disease burden. And in women, that includes things like polycystic ovary syndrome, endometriosis, ulcerative colitis, any number of different gut issues, autoimmune diseases, as well as the other kind of non-gender specific diseases that you might think of automatically when you think chronic disease. But it also means that the health insurance, which is there to act as a gateway to traditional healthcare, is also becoming untenable for a lot of for the people who purchase it, whether that's companies or individuals. And that's because health insurance, and the clues in the name, was meant to be there for emergencies only. You're not meant to use it as a kind of a bedrock for your care. It's not meant to be the thing that you use to keep you well or to prevent you from becoming accidentally unwell. It's there if in an emergency you need to access something that can help you with that emergency.
Right, okay.
And so what we're seeing now is, because historically there haven't been alternatives, health insurance is just going up and up. It's like, okay, you want physio, you want support for mental health, you want support for chronic diseases. Sure, we can support this, but then it's going to cost you, as an individual, 90,000 dirham per annum. We had a woman in one of the groups the other day who was asking for help because she had put ulcerative colitis as a pre-existing condition on her application. And the minimum she was quoted for a year was 93,000 dirham.
Wow. That's a lot.
It's a huge amount.
It's a lot.
Where do you get 93,000 dirham from?
Yeah.
Along with your
other expenses,
kind of massive expenses.
Yeah, of course.
And so for individuals, the burden of chronic disease is being felt much more prominently, much more immediately. It's becoming an issue. A lot of people just aren't buying health insurance for themselves now.
Yes, of
especially freelancers, sometimes for 2, 3, 4 years, basically as long as they can get away with it. For companies, where you have a group premium, you don't need to declare chronic diseases up front. They don't ask about chronic diseases.
Oh.
But if those chronic diseases result in claims against the premium goes up
Okay.
by 10, 20, 50, 80% the following year. And then every year it goes up. So you have a population of 500 employees. Let's say you're fortunate enough to be paying, say, 2,000 dirham per head per annum. That's a million dirham of premium. You get one stage 4 cancer diagnosis. And we already talked about the fact that 80% of breast cancers, for example, are diagnosed at stage 4.
Yeah.
That's 400 to 600,000 dirhams worth of treatment. Your premium will go up by a minimum of 50% the following year.
Oh my goodness. Wow. See, these are things you would never think of. Like, as an employee, I would never know that. I would never know any of that.
No. And so, and imagine so if you have fewer than 150 employees, you don't have to declare your claims history the following year.
Okay.
So if you have fewer than 150 employees, you could just rotate through insurance providers and be quoted roughly the same thing every year.
Okay.
If you have more than 150 employees, insurance providers can see your claims history, and so you can't escape that, like, reliable increase in premium.
Right.
But imagine you have 151 employees. You've just passed the 150 mark.
Yeah.
And unbeknownst to you, there's somebody within your organization who has a history of fibroids and polyps and, estrogen dominance that is growing these things, and they found a lump and they don't know about it, and there isn't the support for it, and it's not being spoken about in the workplace, and they're worried that they'll get fired if they bring it up because cancer treatment is expensive and it's time consuming, and
that's time off from work, and then so you're
exactly,
of course, yeah.
And we're obviously in breast cancer awareness at the month at the moment, and thinking about it and talking about it a lot, and that's why it's a good example to give. But there are hundreds of chronic diseases for which this assessment is also relevant. And if companies aren't switched on to the fact that an unhealthy workforce could result in your insurance premium doubling the following year, that's dangerous for companies. It's dangerous for the ecosystem. We know that chronic diseases are increasing to rise, continuing to rise. If they aren't managed effectively within the ecosystem by companies who are the primary payers for healthcare, at some point it means that a lot of those companies will become unsustainable.
Yeah, of course. And as you said, an unhealthy environment or work environment or an unhealthy workforce leads to much greater losses, and not just financially. It means much
higher
losses.
turnover. Globally, they reckon that 6 to 7% of payroll goes towards poorly managed chronic conditions in a workforce. But and this is like, we haven't even got on at this particular point to talking about the actual benefits for your workforce if you effectively manage their health. The fact that they then, let's say you're a couple that is wanting to have a baby. Per IVF cycle, you will take on average, as a woman, 8.7 days of sick leave. And a lot of couples will go through multiple rounds of IVF to conceive.
Yes.
If you could conceive naturally and then have a low-risk pregnancy, the amount of time you took off work, firstly, would be much lower. How present you were when you were at work would be much higher, because you're not worrying about all of these appointments and the fact that you're navigating a high-risk pregnancy. Right. There's so much benefit associated with really investing in your people's health.
Of course.
I was reminded very palpably of this the other day, actually. We had a new dietitian join us who's also a new mother. And it became obvious after a few days that she was really struggling leaving her baby at home. And I hope she won't mind me telling this story. Beautiful, beautiful woman, and a very gorgeous baby.
Oh.
Anyway, and you could see it was really affecting her.
Yeah.
And we have the clinic that we have in Jumeirah, we have an indoor-outdoor play area for children. All of the rooms have toys in them, but we also have a full-time caretaker who is there to look after children that come in with their parents.
Right.
And we said, please, just bring your baby to work. Have her here.
Yeah.
You don't have to leave her. Like, bring her with you every day. It'd be an honor and a pleasure for us to have her here on site with us. And so now she does. And she's much happier.
Oh, that's so sweet.
Surprise, surprise.
Yes, exactly.
And it's she has her, her nanny comes with her. It's such a little thing. It's such an easy thing. It makes such a big difference for her. And, I've got 4 children. My youngest is 5 months old. I take her with me to most things.
Okay.
I'd be heartbroken, especially in the early stages, if I had to leave her behind all the time, if I felt like I was missing things. It doesn't take much to make women's lives a lot easier. Not really.
Exactly.
So, yeah.
And it shouldn't be a punishment. I'm sorry. Like, I'm just going to say it, because a lot of women, I mean, at this day and age, it doesn't make sense for one of the two to work. It's a fast-paced life. It's an expensive life that we live these days. I'm not just talking about the UAE. I'm talking about in general, like in worldwide. It makes sense for both people to work. So a woman shouldn't be punished because she's working and because she wants to. And even if it's not for financial reasons, what if a woman wants to feel accomplished or she enjoys her job? Why shouldn't she enjoy it and enjoy the company of her child and not feel guilty about leaving her child behind or not giving them the attention and care that they deserve at such a young age? And it's upsetting that, when you were talking about it, it's upsetting that a woman would feel like, she feels guilty for leaving her child behind. It's heartbreaking.
Yeah, it is. And it's funny that you use the word punish. So the woman who did a lot of the initial research on the wage gap in the US has just been awarded the Nobel Peace Prize.
Yes.
And she talks about this. She talks about the fact that women and mothers in particular are punished financially for having children, whereas fathers financially are rewarded. So mothers earn less than their male counterparts. Fathers earn than their female and male counterparts.
Yes.
Fathers earn more than their female and male counterparts.
Yes.
So it is actually the case that mothers are punished for having children, again, where their male counterparts are
rewarded for it. Yeah, absolutely.